But now let's take that idea a step further. So no business grows in isolation. Oh, my bad. Let me scroll. All right. Okay, we're back. Across the world, we're seeing a growing intersection between Eastern and Western approaches to healthcare, and with that, a whole new space for innovation and businesses. Our next section, the future of integrative medicine opportunities at the East-West Crossroads, explores how the convergence is opening up new markets, new models, and new possibilities for growth. Our keynote speaker, John Ohneck, President and CEO of Epoch Lasers, will enlighten us with fresh insights on how combining diverse methodologies can lead to more balanced and effective care models. So please make it nice and loud for Jim.
And there's no monitor here? Oh, I got it. I see it's on the floor. Well, good afternoon, everyone. Really happy to be here. I flew in from Cleveland this morning. It was 24 degrees, so I'm very happy to be here to give a talk tonight because it's nice and warm. So as mentioned, this will be a talk about combining Eastern and Western medicine. And we're going to do this presentation through a little bit of a personal journey and some travel experience, and show you the outcome of how the discovery of two different styles of medicine can come together to create innovation and future products and future ways to manage healthcare. I can make this work. So a little bit about myself. So I founded Epoch Lasers in 2019, and I've got over 35 years of experience in laser technology and medical device technology, running medical device companies, growing medical device businesses. I have a patent on a laser therapy device that's used to treat chronic pain. And I'm a fellow of the American Society of Laser Medicine and Surgery. So just a little bit about my background. So I would say I was all about the science. So the science and engineering. So I'm a very engineering technical guy. So what you're going to see is a shift from that strong technical background to this background of doing things that a few years ago would have said, oh, that's just craziness. So really the goal of the company here is to get rid of people's pain and suffering. So from personal experience of having a family member that had dental surgery, had her trigeminal nerve nicked, and ended up suffering with migraines, the healthcare system put her on oxycodone, and she really lost her career. And as an engineer, a biomedical engineer, I said there has to be a better way to do this. So there has to be a better way to treat people's chronic and acute pain conditions, to help them recover faster after surgery, and to try to live life free of pain again. And so we'll do a deeper dive into that. What is pain and what kind of pain? But a little bit about the history. The first laser, this has been a journey. You talk about journey and collaboration. This journey started in the early 2000s when I developed this first high-power laser for treating pain issues, acute pain. And I did the development, the engineering, the science, the core science to find out what's this actually doing at a cellular level. Got the device FDA cleared, and used a distributor company to get it into commercialization. And it was a 7.5 watt laser, probably weighed about 20 pounds. And I actually pulled this out for the presentation and took a picture of it, and it's still functioning. So that was good news. Today, the laser is a little over 5 pounds, close to 6 pounds. It's portable. It's 20 watts. It's quite a bit more powerful. And it could be used in the clinic. It could be used overseas. It could be run off a battery if necessary. And so it has a good user interface, very simple to use, very intuitive. And anybody can be trained to become a laser therapist. They don't have to have a doctorate or a PhD. They can simply go through the core training of a class 4 laser. So again, how this journey began. So in August of 2019, I had a friend tell me that there was a laser clinic or a clinic we'll call it even something different than that, a spiritual healing center down in Ecuador that was interested in my laser. First question from an engineer is, what's that? What's a spiritual healing center? What do they do there? What devices do they use? So really no clue. So I really started from ground zero. And as we know, COVID was up and coming and, creeped in here. So I did fly to Ecuador and I demonstrated this laser at the spiritual healing. We did treatments on the Cañari Indians and on other local people down into Cuenca in this area of Ecuador. And people got better and they got better quickly. And they accepted, light healing as being something normal. So my daughter is a PhD microbiologist, and I said, do they have something in their DNA that makes them respond so fast to the laser? And they said, no, Dad, they just don't know who Johns Hopkins is. They don't have a Western medicine bias. They feel that light and Mother Earth, all these things will get them better, so they're very open and receptive to the treatment. So I'm not saying that what we saw was a placebo effect, but what we're saying is that there was no nocebo effect. There was no negative thing that affected their treatments. And so climbed up the mountain and had a ceremony with the Cañari Indians and drank all sorts of things that were kind of weird. And I had somebody tell me there, it's like, oh, you're going to lose your science by doing this. And but this started the journey because I started to learn a little bit about meditation and about prayer and how local people here in Ecuador use this routinely. So it made me curious. So through that group of people, I then flew to Japan. They said, oh, you have to go to Japan. They do these really interesting things with meditation to help try to treat pain. And they look at health care differently. They look at the whole person, not as a correction of a symptom. So here in the West, if you go into the doctor for a sore knee, he's going to say, we're going to do A, B, C, D, E, F, G in order. And ultimately, then you're going to need a knee replacement. But in Japan and China and in Asia and Eastern medicine, they look at the whole person. And they say, what is wrong with this person besides just the knee? Are there other health conditions? Are there other nutritional things? Are there other problems with the person that could affect the knee? So it's a little bit different approach. So my first trip to Japan was to learn a bit about meditation and to be a little bit enlightened about that. At the same time, I was starting to think about neuropathic pain. So neuropathic pain is a pain that doesn't really have any underlying root cause. They can't necessarily go diagnose it. You can go in and have an X-ray or an MRI or CT scan, and they say, we don't really know where this pain is coming from. And, you can see here, it could be a pain caused by injury to a nerve or some disease that affects the nerve pathways. It's spontaneous pain, tingling, numbness. These types of things happen with neuropathic pain, but it's hard to treat. So again, I say, what's the path here in Western medicine? Path is medications, antidepressants, NSAIDs, or stronger painkillers, an attempt at physical therapy, maybe some counseling, some nerve stimulation, or even surgery to sever the nerve. So that's the path for neuropathic pain. And again, my thought process is, well, there's got to be a better way. And what happens if I start to use the laser in conjunction with something like meditation? Would that help? What happens if I combine these two things together? And this is really what started the idea of this trip and this travel. So back to Ecuador I go. And now we're right in the middle of COVID. Couldn't travel anywhere, so I might as well go back to Ecuador because they were open for business. So I could still go there. And then I began to learn more about meditation, a little bit about chakras and about meridians and about spiritual healing. And I was much more receptive to it, having done this little bit of travel. I started to be open to it and saying, okay, it's not what I consider science, but there's more here than meets the eye. Back to Japan. So I go back to Japan and I went up this Mount Kurama in Kyoto. This is where Reiki supposedly originated, was from this mountaintop. And you stand on this little plate here in front of the temple and you feel this energy go through you. which was just, again, another strange feeling. It's like, was my brain playing tricks on me, or is something actually happening here? And so I began to study that more. And I went to a clinic in Japan where they were integrating modern diagnostic techniques for the body with meditation, healing. And so this was something they were actively doing in a clinic that people went and to see. And I started thinking, do we have that in the U.S.? Does anybody know of a clinic? Maybe now a little bit, but back then, did anyone do this in the United States? If it was, it wasn't well talked about, it wasn't well touted, and it was very few and far between. So this was a kind of a way to show me that you can start to combine technology here with these other healing techniques. So I kept going, but to learn about meditation, I felt I had to experience it. And so, I tend to, my kids will tell you that I don't do anything just off the side. I dive into it deeply. So I went to Thailand and I did a deep dive meditation class for several weeks. And I really learned about it and how it could be potentially applied in a healing clinic, and how when it's used in conjunction with the laser, you can do amazing things, even treat people with neuropathic pain. And so this was really, the gentleman, his name's Bob Fix, and he wrote a great book called Clearing Cellular Memory. And the class was very good because he not only talked about the spiritual aspects of meditation, but he talked about the science of it. He talked about studies that had been done with brain waves. So he really did a deep dive into it, where I could really learn and understand it as a more technical-based person. And, you can read some of these things. I'll just leave this slide up for a minute, but the benefits, you can get enhanced healing, enhanced pain relief, better energy flow, stress reduction, better mental clarity, using this holistic approach and integrating it with the physical contact of the laser healing. And you can get, spiritual growth from it as well. One thing I've noticed, I've been a laser practitioner for a long time, almost 20 years. And I can tell you that a lot of times, most of the time, a switch is flipped in people where they suddenly wake up and they get a few laser treatments, their pain levels dropping, and they say, hey, I feel good. I'm going to start to go for a walk. I'm going to start to do some exercise. Hey, I'm going to start to pay more attention to my nutrition. All of these things contribute to their overall health and well-being. Again, that's more of a whole person approach as opposed to just one up. I'm going to give you one laser treatment in the knee here. I then discovered a group in Puerto Rico, and they contacted me and they say, hey, we hear a little bit about what you're doing. We've seen some of the talks you've given, and we set up a clinic and we do meditation healing as well. So we got them a laser. They came down. I went down there to Puerto Rico, and they were going to put the laser to the test because their clientele were coming into them to do the meditations and to be healed. And now they added to this the laser. And so Dr. Falcon was great. He's a credible physician in Puerto Rico, and to actually apply and do these things and do some study with he and his wife. Get back to that in a second there. October 2024, I then went to China. And this became an interesting trip because now I have this background knowledge of these kind of Eastern medicine techniques and how they can be helpful when combined. And Shenzhen's a very high technology, place, a high technology city. So I went there and learned about some new ways about treating the whole person again, and about high technologies that we don't use here for healing, like terahertz. We use terahertz for diagnostic purposes, for the airport scanners as an example, but over in China, they're using them therapeutically. And so this was a fascinating, again, way to see how they applied technology into their Eastern medicine thinking. So all along, I heard this statement, and about the light body. We're a light body, and I would say I changed my perspective over the years. Saying at first I thought this was a little kind of a goofy statement, and now I totally understand what this means and the impact that it can have. The doctor in Puerto Rico that I mentioned, Again, he's very well versed in the chakras and meridians and acupuncture and acupressure. And he and his wife have been doing a deep dive for a couple of years in actually doing patients and treating patients with these. And he's really seen great results to help heal the chakras. So different approach. I take the laser as a practitioner, I laser your knee. He takes the laser and he puts it on a chakra point, and he gets healing. And I find that fascinating. I can't explain it scientifically, but it seems to work for the group of patients that he has. There's innovative energy work where they get physical relief as well as emotional and spiritual healing of well-being. Again, the chakra system activation with the laser, he's very sold on. He thinks it's a really good approach because now he's treating what he believes to be the whole person, not just the point of pain, as an example. Then he started doing work on the meridians, much like, and he learns this from his acupuncture. You can actually run the laser over the meridians and actually treat people as well to treat conditions. So very, very interesting work, but this truly integrates the technology with these types of more Eastern medicine healing. And if you combine them in one clinic, what we've shown now in two locations is that you can really get powerful healing and results for the patients. So I put this together as an opportunity to show you that be creative. If you travel around and note what other countries do, how they treat their people and what medicine they apply, and that you can definitely move around and look and understand and treat. So again, the place in Puerto Rico, they incorporate traditional Chinese medicine, patient consultation, meridian lines, knowledge, targeting root causes, and enhanced effectiveness in patient treatment. Also, when I was in Thailand, I learned about, it's called Thai Rishi Yoga, and doing yoga along with the laser is also an extremely beneficial help for patients. They are able to stretch and extend. Older people can learn to touch their toes. When you do both, you give them flexibility through the treatment of the laser. You help heal them and heal their muscles. And at the same time, they can stretch as well. So together, they're very good adjunctively. Go back here. And they make very good adjunctive therapies. So my point today is to really say there are lots of opportunities if you own a clinic or you know somebody that owns a clinic to integrate these therapies together to really help healthcare and take it away from just I'm going to go into an impersonal office and get a prescription to I'm going to really help heal the whole person and how they feel. So there's still some science though, okay? And there's technological advances. What has been the outcome of some of this? Well, you can take a capsule and you can put technology into the capsule and you can treat the whole person through a group of different technologies. So here, this capsule you see called the Immersion. So it has far infrared technology, terahertz, magnetics. There's been people treated with magnetics for many, many decades. Negative oxygen ions. It produces these ions that you would get if you did a walk in the forest or along the beach. These negative ions are good for you. There's vibrational therapy, and it's actually adaptive. One of the things that I did learn is that there's a body of evidence that shows different parts of the body put out different frequencies. And this device actually reads these frequencies and it puts in these corrections to try to help heal the whole person and heal the parts that maybe it's not the sore hip it's healing, but it's healing other things. So these were in trials all last year. And so we've got a good body of data from patients from every treatment. And we really see some really amazing things happening with it. So this is I don't want to call it a whole body healer, and I don't want to call it a panacea. It doesn't cure everything, but the results from the trials have been really, really fantastic. So, if you want to delve more into this, if this kind of thing interests you, I have a book I wrote in a lot more details about how the laser is used in conjunction with these, medical treatments with the laser. and how they can potentially be brought here to the United States. So I thank you for your time and attention. Any questions? Great. Well, I hope I've given you some ideas at the very least to see how things can be merged together to help eliminate people's pain and neuropathic pain. So thank you very much.